Planet Vero Studio is powered by the Nolan Group of eXp Realty.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
And welcome to Community Conversations, and I hope you're having a wonderful afternoon. If this is the first time that you've had the opportunity to listen to this part of the talk show lineup, we bring people together for a variety of reasons. We are a nonprofit at Treasure Coast Community Health that provides primary medical, dental, behavioral health, sort of a one-stop for any of your physical needs from a primary care perspective. We do accept a lot of different insurances, and we also have a sliding fee scale discount for people who are of a lower income at certain times in their life. So one of the things that we do together is bring people from other nonprofits that we collaborate with, sometimes for-profits as well. I don't want to be exclusive. But we bring them here to the studio so that we can talk about different things that they do, different events that are coming up that might be of benefit to you all, particularly if you're new to our community. So this week I have as my guest Anne-Marie Suriano. Anne-Marie is the leader, executive director leadership for the Hospital Tax District of Indian River County. And I got those words all scrambled up, didn't I?
That's okay.
Okay, Indian River County Hospital Tax District, yes, which is something that not every county in Florida has. So maybe the first thing we should start with is how does Indian River County happen to have a taxing district specific to the hospital?
So we, in our conception, I guess, or inception, we were put into place by legislative act of the legislature of Florida. We have a special act that we were asked to create a group that would benefit our then Indian River Medical Center for uncompensated care.
A standalone hospital that would not otherwise have funding?
That's correct.
Okay.
So it is a public hospital and is today and was then very small but growing. And so a group of administrators, I suppose, at the hospital asked the legislature for the ability to assess a property tax. So we assess a property tax since the early 60s. In order to support the hospital at that time, and today now provide funding or assistance for 18 different organizations in our community that provide either primary care, dental, behavioral health, like Treasure Coast Community Health that does all of those things. Also, more recently, substance use services, optical and Healthy Start, who does assist with our Partners program, which is a district program that was initiated some years ago, probably 20 years ago, that the Cleveland Clinic Indian River Hospital now administers. So
the hospital portion is not incorrect. They still receive the partial benefit from the tax collection, but you have expanded the number of organizations that are also affiliated in some manner with healthcare in the community.
Right. And so many people are confused. Not, as you said in the beginning, not a lot of communities have a hospital district or a healthcare district, taxing districts. As a matter of fact, it is an independent special district. So all of our revenue comes from property taxes in Indian River County, but there are several, probably only 4 or 5 now, hospital districts and a couple more healthcare districts throughout the 35 counties of Florida. So that is a unique situation for Indian River County. So much of the confusion comes in, you are the hospital or you are a part of the hospital. And as a matter of fact, we're a very separate organization. We are the taxing district that appears on your property tax bill, but does that for good reason, and which is what makes Indian River County unique and makes Indian River County special, that all can receive care regardless of your ability to pay. And so we do support organizations that provide healthcare services for those that can't afford, are uninsured, or do not have the access through their insurance or ability to pay for healthcare services.
And so you have an independent budget that is made up in terms of how it rolls out to the taxpayers. There's a certain amount that is assessed on property owners. And how is that amount determined?
So each year we have a funding process, and we are obligated to the state we work through the tax collector's office, local tax collector's office, and the property appraiser's office. And as the owned properties in Indian River County are assessed annually, we have to provide for a budget, which is a zero-based budget, meaning that most of the revenue that we collect in property taxes goes back into the community. So we have this year one of the lower budgets that we've had, but are providing funding for more organizations than we ever have in the past.
But you don't make up the budget. You've got trustees.
Right. So
explain that structure to us.
Okay. So we have 7 elected trustees, and we have a staff of 5 in our offices. We receive funding requests from any of the organizations that provide, most of which, to your beginning, are nonprofit, not-for-profit, but we have a couple of for-profit organizations that provide services to underserved populations, I suppose. And so they come to us with the request. Our office staff administers those, or kind of weeds through those, collects that data, feeds that to our trustees, our elected officials. They are 7 elected officials. If any of those vacancies come up during the course of their elected term, the governor does appoint to that, so that there are always 7 members on our board that can administer those funds. We then turn that budget into the state. Property appraiser assesses how those taxes are or where the money comes from, I suppose, and then that tax collector collects those funds, and then they distribute those funds to us.
Very similar to regular county taxes.
Right. It works just like the county commission, just like the school district, where their taxes are all, and we pay commissions to them to collect and distribute those taxes to us, and then we distribute to all of the organizations that provide those services.
Now I'm going to go out on a little shaky limb here, but your trustees are voluntary. They don't get paid, as opposed to some of the other trustees that might do similar judicial and administrative tasks.
Yep. So that question has just recently come up because we are the only taxing district that has volunteer, unpaid elected officials.
Through the state of Florida.
Through the state of Florida. So there is a Florida statute that prohibits any hospital district from being paid to serve in their elected official capacity. So all others, including very small districts like water districts, mosquito districts, all of those, whether they are elected or appointed officials that make that happen in their community, are paid for their service, if you will, albeit probably a pretty small salary, because again, those are tax dollars that are collected, and not all districts, independent or dependent special districts that collect tax, are based on property taxes. Some of those districts get a percentage of sales tax, or some other type of public dollars that are distributed. And so, to keep us relevant in our communities, that is why they all have, very low administrative costs, usually less employees. I mean, obviously, county commissions and city councils and those kinds of things have much more or have a lot more employees because they do a lot bigger work, I suppose, in their community. But yes, our people are unpaid and volunteer and not necessarily professionals in healthcare. Many of them come from, they are elected people. So it is political in nature in the fact that they are elected to those positions.
But that diversity brings different perspectives to the table in terms of especially the role of the different organizations that are asking for support and funding.
That's right. You need business background, you need finance background, you need, some health background, but it really is a business in that, we have all of the same responsibilities, I suppose, as any business does.
And are the terms all 4-year terms but staggered?
They are. They are. Every elected official serves a 4-year term. There is an election every 2 years, and so 4 of those are elected in 1 year, and then 2 years later the 3, and then those would cycle that way every 2 years. So 4 and 3 on a 4-year term.
And just as in other public elections, there's the ability to do multiple terms consecutively.
Yes, there are no term limits. So as long as you can run for election and as long as you can serve, we've had trustees that have served for 12 and 16 years, actually.
Nothing wrong with history.
That's right.
Yeah.
That's right.
So.
And, some of them start really young, and so they can, work through their work life and into their retired life. The bulk of interested parties in running for a volunteer board like that are typically a retired person that has great expertise, really, in, like I said, business, finance, or health.
So we just had elections, which means you've got a couple of people to start out this January.
We do.
And do you give an orientation to those folks? We
do. So just last week, the attorney for our board and myself sit individually. We are bound by, all trustees are bound by the Sunshine Law and Public Records Act. And so no 2 trustees can sit in the same room and talk about district business without it being a public meeting. So we scheduled them independently for their orientation. We spend an hour or 2, depending on their questions and how familiar they are with the Board of Trustees or the hospital district or, our community partners, and go through their roles, responsibilities, the Sunshine Law,
so that they hit the ground running.
That's right. So they will all start. We have 3 this year that are new, or this election that are new. 1 reelected in that 4-year, and so they will sit in our January. We meet the 3rd Thursday of every month in a public forum, and so they will be sitting in our January meeting.
So you've given us a lot of structure. So before we leave that and take a short break and move on to some of the current things that are going on with and through the district, could you give them website if people wanted to learn more about?
Right. Is IRCHD.com. Is our
short and sweet.
That's right.
IRC
HD, Indian River County Hospital District.com.
Wonderful. So we're going to take a short break for a word from our sponsors, and then when we return, as I promised, we'll be talking about more current types of things. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Affordable Water continues to offer you the best water on the Treasure Coast. Earn a competitive salary and a 401k, working weekdays as a delivery driver or water treatment tech. To apply, stop in at Affordable Water in Sebastian at 645 Old Dixie Highway.
Hi, this is Julie Lilliquist. From all of us at Evergreen Media and Planet Vero, thank you for your support in the last year. We wish you a wonderful holiday season and a joyful new year.
Right now at Sunshine Furniture, it's holiday sale time. They are clearing out their warehouses to make room for new furniture styles, and this means you can save on selected styles from Lloyd Flanders, Beechcraft, Windward, Riverside, Universal, Caprice, Four Seasons, and more. Sofas, dining sets, patio groups, occasional chairs, cabinets, bedroom sets, and occasional tables. There are lots of pieces on sale from inside and out, just in time to make Santa say ho ho ho. Sunshine Furniture has the largest selection of coastal furniture anywhere, including a gallery of Tommy Bahama Home and a Universal Coastal Living collections. Visit Sunshine Furniture now for their holiday sale. And right now, all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in Vero Beach. Online at sunshinefurniturecasual.com. And don't forget to shop their outlet and sell store just across the street.
Sunshine Furniture.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. As I said earlier, we're privileged to provide a lot of different primary care services, whether you have insurance or whether you don't. Primary care is really important. We're privileged to have a lot of specialists in our community, but we kind of need a groundskeeper, somebody who's right there with you, helping you make decisions, making those referrals to specialists as needed, getting their reports, sort of your advocate that's always by your side. And so we're very happy to do that for over 28,000 community members and growing. So you'll be hearing a lot more about us as we have 8 different locations and looking at different ways to improve accessibility to meet your needs. So a huge part of our success has been the support of the Hospital Tax District, and Anne Marie is the executive director there. And we've talked a little bit about the history, the support administratively that you offer the community, you and the trustees. And so one of the things that I want to talk about is that you offer more than funding as supportive measures. So would you like to elaborate a little bit on that from your perspective?
Sure. So, you know, a lot of times in our community, for those that know about the hospital district, as an independent special district, we're not the hospital. We have hospital in our name, and so everyone thinks, oh, you work for the hospital or you're a part of the hospital. And so important, I think, for our community to understand is that those in the community that need healthcare services have access to those healthcare services because we have an independent special taxing district in our community. And so we have a separate office, which is located downtown, kind of within the community we serve. We're not on the hospital campus per se. And although we work closely with the hospital, we do that in the sense that the hospital district owns the grounds and the buildings so the main hospital itself, Cleveland Clinic Indian River Hospital, I guess there are 2 hospitals in our community, and the Behavioral Health Center, which sits across the street. But we also own the building to the south of the ER ramp, which is the Human Services building, and we lease that building to the Visiting Nurse Association to provide their home health and outside hospice services and some other community services. And then we lease the parcel to the east of the hospital campus, which is where the hospice house sits, and the grounds ahead of that to the VNA as well. And then we have the Gifford Health Center, which we lease to you, to Treasure Coast Community Health, to provide those primary care services to our community in that sort of to the north area. And I think a lot of, your patients come from that area. So we lease all of those properties to providers, to our partner providers, for a mere $1 a year, so that
I'm
you
sitting
can
here as you're going
provide.
through that, thinking about how fortunate this community is that the originators in the 60s and 70s bought those parcels of land, because we couldn't do all the things that we're doing as a community now without having reserved that space for these ventures that continue to bless our community, like the hospital and the VNA Hospice House. And
Right.
With the price of land these days, what a great thing.
And we do own another 40 acres out west of town, which was anticipated many years ago when we acquired that property to, for hospital service expansion. But, and that is rolled into the lease with the hospital, Cleveland Clinic, Indian River Hospital. So for their purposes, if ever is needed, or the growth of healthcare services out to the west of our community.
Yeah. And, you made a point that the hospital district only funds our Vero Beach Hospital. Does that mean you guys don't like the Sebastian one?
No, not necessarily, but Sebastian River Medical Center is a for-profit organization, and we do have some criteria, I suppose, about financials and disclosures, and so they have not come to us to ask us for
Didn't mean
funding
to put you on
for
the spot exactly, but
that's
I'm
fine.
sure
But
other
people
do
want to understand. Yeah,
Yeah.
it's important to understand that difference in that for-profit and not-for-profit, and community public hospitals have different criteria, I suppose, of those that they accept and can accept and keep and
just like your criteria has changed over the years in terms of what's acceptable, in terms of utilization of the services by individuals. And I'm pleased to say you've removed a lot of barriers. One of the things, though, out of respect for the people that are paying the taxes, is the residency requirement here, that people who use it need to live in this area.
That's right. It is Indian River County tax dollars, so we like to provide that for our Indian River County residents.
So everybody that dispenses things has rules. It's just the fact of life.
Right, and we have moved a little bit away from that, quote, indigency to access for all people that need services that may not have coverage for those services. So there are a lot of, services that are offered to all within our community.
Yeah, and again, I want to thank the trustees. And a few weeks from now, if you come back at 4:30 on Saturday, you'll be listening to Mary Beth Cunningham, who has been the chair of the Hospital Tax District Trustees Committee, to hear a little bit more about their strategic planning, the things that they debate, to keep us current and at top-notch game through this community. So, Emery, I'm really, really happy that we were able to get you scheduled today, and wish you a very happy holiday season. And we'll look forward to Mary Beth coming on board in a few weeks to talk about the innermost workings of the trustees.
Perfect. I think that's great. And thank you for having me, Vicki.
Thank you. And again, I hope that you all will revisit us in at least 3 weeks, if not sooner, because that will be a very interesting and helpful conversation as well. So take care all. Have a great evening.